Good afternoon. Good afternoon. Welcome to the Real Talk page. My name is Ayele. My pronouns are she, hers, hers, and I'm the Community Health Education and Training Coordinator for Whitman-Walker Health. During the COVID-19 pandemic, Whitman-Walker's Community Health Department has expanded our outreach efforts across the social media platforms. We will cover various topics about HIV, STI, sexual health practices, access to care, social determinants of health, and public health interventions. And the community health team is here to educate and support you. If there are any questions, please feel free to leave them in the comments or reach out to us here at Whitman-Walker Health. So again, my name is Ayele, and welcome to the second part of the two-part live series for Sexual Health Awareness Month. As you may know, September is full of so many important events and celebration. Days like Labor Day, the Labor Day holiday, the end of summer, welcoming in fall, National Nutrition Week, Beyonce's birthday, and what brings us here today, Sexual Health Awareness Month. So our Sexual Health Awareness Month lives have been in two parts. This is the second part. Last week we discussed pain, where we went into STI prevalence and prevention. And this week is all about pleasure and discussing pleasure with parents, providers, and partners. Talk about pushing P. So let's get started. Hi, Excel. So talking with parents about sex can feel a bit scarier than it actually is. With a little planning and practice, you'll be ready to start the conversation. If you're a minor, it may also become necessary to discuss pleasure with your parents, and they can always be a great resource if you feel comfortable to. Parents can equip themselves with information before the birds and the bees talk, but also as a child, you can come ready with questions and learn about how your body works, and practicing healthy sex practices. Starting a conversation can be the hardest part. Promise, it gets easier and easier over time, but there's some tips that I have to help you out. Try using a magazine article or TV show to help getting the conversation started, and then you can work into things that are more personal to you. If you're more comfortable communicating electronically through email, text, or instant message, go for it. It doesn't matter how you start the conversation. It just matters that you have the conversation. But it can help to give your parents a heads up. Let them know, can we have a private talk tonight? Or can we have a personal talk tonight? To get them ready for what could be a personal conversation. You can break the ice with things like, this feels weird, or this is going to be weird for you, but I have these questions. But acknowledging that weirdness or awkwardness can sometimes help to make it go away. So you can think of questions and come with what you want to learn if you have things already, and those can be helpful. I think writing it down can be helpful as well, because in the moment you might forget some things. So having a written down list of things that you're trying to get out of the conversation can be helpful for that as well. Next with parents, they can give you, you could ask them what their parents talk to them about, how to know when you're in love, how to know when to have sex, or how to protect yourself from pregnancy and STIs. Let them know why you're asking, what your concerns are, and try to understand what they might be expecting from you as well. Unfortunately, parents can get uncomfortable or discomfort about sex. Worse, some can make you feel unsafe, threaten, or punish you for bringing it up. So if you feel that asking these questions about sex will put you in danger, don't do it. And if you're very concerned about your parents' reaction, you might want to put off the conversation until you and your parents feel more ready. And maybe, and in that case, or if your parents aren't around, make sure you have a trusted adult, whether it be a family friend, relative, counselor, health educator, like ourselves at Whitman-Walker, or a medical provider that you can go to with your questions and concerns so you can get information. Yeah, and a lot of parents don't feel comfortable bringing up sex, healthy sex practices with their kids. I remember my mom did. She was very graphic with it, very young. I think that's why I feel very comfortable talking about it now. But it can be hard to start the conversation. And And that's why it's important to equip not just parents, but youth as well for those conversations to make sure that everybody is getting what they need out of the situation. And when I had said about the medical provider or health educator, I mean providers in general. So anyone that takes care of your health, of your physical health. And this could be part of the visit with the providers, your annual physical, sorry. But it's important for that instance as well to come prepared with questions. And I will go over some of those questions that can be great to bring into that space as well. It's important to always be open and honest with your provider so that they can help you in the best way possible. Some sexual issues can be a sign of underlying medical problems as well that need treatment so that you don't become unwell. So it's important to check and be sure. Also, your providers can suggest various screenings and medications to help keep you safe. If you don't feel comfortable speaking about your sexual health with your doctor or a pediatrician, seeing a same-gendered provider or a specialist can be helpful if it's available to you. If you want to start your appointment by telling your doctor why you're there, that can be helpful because it might be unlikely that they asked about sex unless you bring it up. So it's important to say that that's the part of your concern of your visit, if that is one of the concerns for your visit. It might help to have something written down in advance for this situation as well and read it out to the doctor. This can help also if you're feeling nervous or don't want to forget anything that you want to bring up with your provider. But the more information that you can give, the more helpful your provider can be to you. So don't be afraid to be specific. I promise they've seen it or heard it before. So including where any problem is on your body, or if there are any things of concern. Okay. And don't be nervous about going into the doctor. But I know that it can be a nerve-wracking situation, especially the possibility of having your genitals examined during a visit can be quite nerve-wracking and off-put people to going to the doctor for sexual health issues. But it's still very important to go to a doctor, and so if they do suggest a physical examination, you can ask what steps will this include, what things will this include. You can postpone it to another day where you have time to prepare and feel more comfortable for that visit. Then also you can bring a friend, partner, or arranging a chaperone that can help you feel more comfortable as well. Those physical examinations always also should go at the pace of the patient and allow for you to dictate what happens. Making sure that you have informed consent and you provide that informed consent to the provider at each step. Because a lot of doctors are taught that speed is important in those intimate examinations, but it really should depend on the patient and what is needed. What's needed in that room, just like in sex, is consent and communication. So making sure that you are being asked for that in the medical room, in the provider room, is important as well. If you're feeling nervous about this exam, especially if you've experienced or survived sexual abuse, rape, or any traumatic medical experiences, there are certain things that you can request to help make it a bit less nerve-wracking. Asking that your provider goes slowly and checks in with you before moving to the next stage of exams. And stopping and reducing contact if you need to. You can use a safe word, or let them know to slow down if you are feeling uncomfortable. There are also things like anti-anxiety medications or over-the-counter painkillers that can help before a visit as well. But also you can request that they go through the examination with your clothes on first so you know what to expect. You can even use your hands to show them your genitals so that they don't touch you. And if something needs to be inserted in you, such as a speculum or ultrasound wand, you can request to do the insertion and removal yourself. It might not always be allowed, but it is a request that you can, that is sometimes accommodated for as well. And anything else that will help you feel comfortable, because truly the visit is about you. If they do say no, they should explain why. They should have a reason why. Otherwise, and suggest alternatives to help make you feel more safe and comfortable in the provider room. And again, you can always put off the exam to another day or to another doctor if you don't feel comfortable. But it's really important that you feel comfortable in the room. And lastly, speaking with pleasure about partners, speaking with pleasure with your partners, when you know what brings you pleasure, you should share that with your partners. You can't expect a partner to know what you like unless you tell them. Nobody is a mind reader unless you're that so Raven. But no two people have the same fantasies or want to be touched in the same type of ways. So talking to your partner about your desires and boundaries is essential. So learn more. So we'll talk more about having that conversation and things that you can include in that conversation as well. This can be like condom negotiation and setting firm boundaries. It can discuss STI testing, expectations on monogamy, birth control options that work well for you. But truly, good sex comes from understanding how the body works. Everyone likes different things, so don't worry about whether you're normal, because it's not one size fits all. What feels good to you might not feel right for someone else, and vice versa. Everyone's different regarding sexual behaviors and desires, and people get turned on by different things. So, communicating about what you like or don't like lets your partner know what's okay and what's off limits. But in general, having a healthy sex life is good for you in a lot of different ways, emotionally and physically. It not only helps with creating a connection with another person, but sexual pleasure has a lot of health benefits. So that's why our live today is entitled Pleasure. But whether you're with a partner or not, when you have an orgasm, your body gets a natural high. You release endorphins, which are hormones that block pain and make you feel good. So, other than those two things, there are other health benefits associated with pleasure as well, such as better general health, sleep, self-esteem, fitness, less stress and tension, and even a longer life. But considering all of this, there is no amount of sex that's considered normal. Everyone's different. How often you have sex depends on a lot of different things, like whether you have a partner, what else is going on in your life, and how strong your sex drive is, or your desire to have sex is. People have different sex drives, and your own sex drive can change based on things like stress, medications you take, and other physical, emotional, and lifestyle factors. Some people want to have sex every day or more than once a day, and some people hardly ever want to have sex. But people who don't experience any sexual attraction may call themselves asexual as well. But in general, talking to your partner about your likes and dislikes and your boundaries help to build a healthy relationship and a satisfying sex life. Sometimes you expect a new partner to know what to do sexually, but can end up being disappointed when things don't feel that good. Luckily, there is a pretty simple way to turn it from okay to a great experience, and that is communication. Talking about your pleasure, talking about your wants and needs and expectations. Because again, everybody is different, no matter how experienced somebody may be. But some people figure out what they like by having sex with someone. Other people get to know their bodies by masturbating, because learning how to have orgasms on your own can make it easier to have one with someone else as well. So even with our partners, talking about sex can be a little scary or awkward, but it can also be a turn on. Again, whatever floats your boat. And your partner might really appreciate you for bringing it up. If you're nervous, you can always start by asking them what feels good to them and what type of sexual activities they're interested in. You can talk about what feels good to you, and it's a good opportunity to let them know about your boundaries as well, and what type of sex you're not interested in. Protecting each other from unintended pregnancies and other STIs shows you care, and it can even help to make your relationship better. It's totally normal to feel embarrassed or nervous to bring it up, but often you'll feel better once you start talking. And your partner will probably be glad you brought it up as well, or they're thinking about bringing it up as well. But the best time to talk about safer sex is before you start having sex. And a good way to let them know that you care about them is by letting them know that is by protecting them in this way. So you can also talk about your own safer sex history and practices as well, first, which can help them feel comfortable to open up as well. One thing that I always suggest is to get tested together, so you can support each other through the process as well. Some great questions to ask before having sex is, which birth control method makes sense for us? When was the last time you were tested? Which STIs were you tested for? Do you usually use condoms or other barriers? Have you ever shared needles with someone for tattoos, piercings? And because STIs can be transmitted in ways that are not sexually as well. Have you had any STIs before? Did you get them treated? Those are questions that can come up in that conversation before as well. But if your partner refuses to have this conversation or won't get tested or use protection, it may be a sign that the relationship is not the healthiest. But because when somebody refuses to have safer sex when you want to, it means your health is not important to them. So they might not be the best person to continue with a relationship with or to have sex with. You deserve to be safe, healthy, happy, and loved. You also have the right to say no to any kind of sexual activity. Don't depend on body language or hope that they get the hint that you're not interested. If you don't want to do something, say so. It doesn't matter if you've had sex with them before or what your reason is for not wanting to do so. No means no. And you also have the right to change your mind at any time during sex. Maybe you started having sex, then decided you're not comfortable with it or it doesn't feel right. You can stop at any time you want, and your partner shouldn't make you feel bad or guilty about it. If they do, it's probably a sign that the relationship might be unhealthy, or again, this is not something you might want to continue with. But because sexual consent means saying yes and meaning it. Without that yes, there is no consent. I like to always say there's no such thing as a non-consensual sex, because that is rape. Sex includes consent. It's a part of it. So if your partner is forcing you to have sex, it is rape. And you are forced, if you are forced to do something sexually, it is sexually assault. And being raped or sexually assaulted, it is never your fault, ever. We talked about the nuances of discussing pleasure with both parents, providers, and partners. And thank you so much for joining us today on our Sexual Health Awareness Month lives. And if there are any questions, again, please feel free to reach out to Whitman-Walker Health. And we are here to support and educate. But before we go, I want to give you a few reminders about COVID-19 and the vaccines. If you've already gotten vaccinated, congratulations. You've taken an important step to preventing yourself, your loved ones, and communities from illness. Because multiple variants have soared across the world, and it is totally understandable why you might want to keep wearing your mask, because the vaccine is not 100% effective, and more contagious variants are spreading. There are very few protocols in place that actually verify that folks are vaccinated, so it's important to stay alert. And if you haven't been vaccinated and are looking for an appointment, Whitman-Walker Health has the vaccine available. Please reach out to 202-207-2480 to make an appointment. And if you're having trouble making an appointment with us, for DC residents, you can find information on the COVID vaccine walk-up locations and eligibility at vaccinate.dc.gov or by calling 1-855-363-0333. For Maryland residents, learn more about the COVID vaccine distribution process and schedule a vaccine appointment at covidlink.maryland.gov or by calling 855-634-6829. And in Virginia, residents can learn more about vaccine distribution process and schedule a vaccination appointment at vaccinate.virginia.gov or by calling 877-829-4682. If you haven't been vaccinated and are not looking for an appointment, please continue to follow CDC guidelines for mask wearing, quarantining, social distancing, and the like. It's very important that you consider getting the vaccine or discussing COVID precautionary measures with those around you. Be mindful of masks and keep your distance, but especially when you don't know a vaccination status. Also, Whitman-Walker Health is combating the monkeypox epidemic as well. And according to the CDC, there are more than 22,000 cases of monkeypox in the U.S. And in D.C., you can pre-register for a vaccine appointment at dchealth.dc.gov/page/monkeypox. Also, all of this information is available on the Whitman-Walker website. Virginia is working with local care providers to contact trace and identify those most in need for that vaccine. And varying counties in Maryland are allowing residents to pre-register as well for that monkeypox vaccination. And has just released a pre-registration form as well. Please visit your state's local health department for more information on how to register and get vaccinated against monkeypox. But in DC specifically, as of August, there are walk-up vaccinations available from noon to 8 each Friday, or noon to until supplies last, but until 8 o'clock. At the DC Health Monkeypox vaccination clinics. There's one in Ward 8 at 3640 Martin Luther King Avenue in Southeast, and in Ward 4 at 7530 Georgia Avenue Northwest, and in Ward 2 at 1900 I Street Northwest. These vaccinations are on a first-come, first-served basis and eligible to residents who have not already received the first dose of the monkeypox vaccine. You're currently eligible if you are a District of Columbia resident, 18 years of age or older, and all people of any sexual orientation or gender who have had multiple sexual partners in the past 2 weeks, including those currently considered the highest risk, gay, bisexual, and other men who have sex with men, transgender men and women, or sex workers or staff at establishments where sexual activity occurs, such as bathhouses, saunas, and sex clubs. Please remember to follow us on Instagram, Facebook, and Twitter at Whitman-Walker, and check our website, whitman-walker.org, for the most up-to-date information on our services. And for more COVID-19 resources in general, Whitman-Walker services, please call us at 202-797-4439. Please also continue to follow this page, the Real Talk DC page, and our other No Filter DC page as well. Thank you all so much for joining us today. Hope you have a wonderful, wonderful day, and take care.